Hi there, post-traumatic stress disorder or PTSD is a serious mental health condition. It can develop after a person experiences or witnesses a terrifying event. These events, called traumas, can be varied. PTSD doesn't discriminate. It can affect anyone. It affects thoughts, feelings, and behaviors. We need to offer support, reduce stigma, and encourage people to get help. People with PTSD experience various symptoms. These symptoms can differ in intensity and duration. They are categorized into 4 groups: intrusion, avoidance, negative changes in thoughts and mood, and arousal. Intrusion involves reliving the trauma. This can happen through distressing memories, nightmares, and flashbacks. Avoidance involves trying to forget the trauma. People might avoid thoughts, feelings, places, and people. Negative changes in thoughts and mood are common. This includes difficulty remembering parts of the trauma and negative beliefs. PTSD often involves changes in arousal and reactivity. This includes being easily startled, on edge, and having difficulty sleeping and concentrating. PTSD can develop after various traumatic experiences. These experiences threaten a person's safety or well-being. Direct involvement in a traumatic event isn't the only cause. Witnessing it firsthand or learning about a loved one's trauma can also lead to PTSD. Common examples of traumatic events include physical or sexual assault, childhood abuse or neglect, serious accidents, and natural disasters. Exposure to war or combat, terrorist attacks, and life-threatening medical conditions can also lead to PTSD. It's important to remember that the severity of the event isn't the only factor that determines the likelihood of developing PTSD. Individual factors play a role, such as previous trauma exposure, genetic predisposition, coping mechanisms, and the availability of social support. Not everyone who experiences trauma will develop PTSD. The impact of trauma is different for everyone. Many people are resilient and can cope and recover effectively. However, for those who do develop PTSD, it's crucial to understand that it's not a sign of weakness. It's a natural response to an overwhelming experience. Complex PTSD, a deeper look. Complex post-traumatic stress disorder, or CPTSD, is a related condition to PTSD. It often arises from prolonged or repeated trauma, especially during childhood. People with CPTSD experience similar symptoms to those with PTSD. These include intrusive memories, avoidance behaviors, negative thoughts and feelings, and hyperarousal. However, CPTSD often presents additional challenges. These challenges include difficulties regulating emotions, disturbances in self-perception, and relationship problems. The chronic nature of the trauma in CPTSD can lead to deep-seated feelings of shame and worthlessness. Individuals may feel fundamentally different from others. Treatment for CPTSD typically involves a combination of approaches. Psychotherapy, medication, and support groups are tailored to the individual's needs. These approaches address the complex effects of prolonged trauma and help individuals rebuild their lives. Seeking help and diagnosis. Seeking professional help is crucial if you or someone you know struggles after a traumatic experience. It's normal to feel distressed and emotionally overwhelmed after trauma. However, persistent and debilitating symptoms may indicate PTSD requiring professional attention. Recognizing the symptoms is the first step. These include intrusive memories, nightmares, flashbacks, avoidance behaviors, negative thoughts and feelings, sleep disturbances, difficulty concentrating, irritability, or hypervigilance. If you experience these symptoms, reach out to a healthcare professional. Don't hesitate to seek help. A healthcare professional can provide a proper assessment. They can diagnose PTSD and recommend appropriate treatment options. Remember, seeking help is a sign of strength. It's a proactive step towards recovery. With the right support and treatment, Individuals with PTSD can regain control over their lives and experience significant improvements in their well-being. Treatment paths for PTSD. Treating PTSD often involves a multifaceted approach. This approach combines psychotherapy, medication, and lifestyle changes. Treatments are tailored to the individual's specific needs and experiences. Psychotherapy, especially trauma-focused therapies, has proven highly effective. Cognitive processing therapy, or CPT, and eye movement desensitization and reprocessing, or EMDR, are two examples. These therapies help individuals process the traumatic event, challenge negative thoughts, develop coping mechanisms, and manage their emotions. They provide a safe and structured environment to address the root causes of PTSD. Medications can also play a role in alleviating PTSD symptoms. Antidepressants and anti-anxiety medications are commonly used. These medications can help manage depression, anxiety, and sleep disturbances, making other aspects of treatment more effective. Lifestyle changes can also complement the recovery process. Regular physical activity, relaxation techniques like deep breathing or meditation, prioritizing sleep, and seeking social support can contribute to overall well-being and reduce PTSD symptoms. The importance of support and understanding. Navigating the challenges of PTSD often requires a strong support system. This system provides understanding, encouragement, and practical assistance. Family and friends play a vital role in an individual's recovery. Educating yourself about PTSD is essential. Offer a listening ear without judgment and respect the individual's need for space or time alone when necessary. Support groups, both in person and online, offer a safe space for individuals with PTSD. They connect with others who understand their experiences, share coping strategies, and reduce feelings of isolation. Support groups provide a sense of community and validation, reminding individuals they are not alone. Advocacy organizations dedicated to mental health also offer valuable resources. Remember, recovery from PTSD is possible with the right support and treatment. By fostering understanding, compassion, and access to resources, we can help individuals with PTSD reclaim their lives and thrive. Watch out for the next video.